Today, we're diving into a topic that might be a bit uncomfortable for some, but it's incredibly important: what your stool says about your health. Yes, we're talking about poop. Believe it or not, your stool can reveal a lot about what's going on inside your body. From changes in color to consistency and frequency, we're going to break down 11 alarming things your stool can tell you about your health. Understanding these signs can help you catch potential health issues early and keep your digestive system in check. But don't worry, we'll make this as informative and light-hearted as possible. Color changes. First up, let's talk about stool color. A healthy stool is usually brown due to bile from the liver. But if you notice a significant change in color, it could indicate various health issues. For example, black or tarry stools might signal bleeding in the upper gastrointestinal tract, while bright red stools could mean bleeding in the lower GI tract. Pale or clay-colored stools could be a sign of liver or bile duct problems. Consistency and texture. Next, pay attention to the consistency and texture of your stool. A healthy stool is soft and formed. If your stool is hard and pellet-like, you might be constipated, which can be due to dehydration or a lack of fiber in your diet. On the other hand, very loose or watery stool might indicate diarrhea, often caused by infections, food intolerances, or digestive disorders. Frequency. How often do you go? Frequency matters too. Most people have a bowel movement anywhere from 3 times a day to 3 times a week. If you notice a significant change in your usual pattern, it could be a sign of a health issue. Frequent, urgent bowel movements might indicate a digestive problem like irritable bowel syndrome, IBS. Presence of mucus. Seeing mucus in your stool. A small amount of mucus is normal, but if you notice a lot of it, it could be a sign of an infection or inflammatory bowel disease, IBD, like Crohn's disease or ulcerative colitis. Excessive mucus often accompanies other symptoms like abdominal pain or blood in the stool. Floating stools. Have you ever noticed your stool floating? Floating stools can be a sign of poor nutrient absorption, often due to conditions like celiac disease or chronic pancreatitis. It might also indicate too much gas in the stool, often from eating high-fiber foods or swallowing air. Unpleasant odor. All stools have an odor, but if yours has an extremely foul smell, it could indicate a problem. Malabsorption disorders, like celiac disease or lactose intolerance, can cause particularly smelly stools. Persistent foul-smelling stools warrant a checkup with your healthcare provider. Blood in stool. One of the most alarming signs is blood in the stool. This can range from bright red to black, tarry stools. It's often a sign of bleeding somewhere in the gastrointestinal tract. Hemorrhoids and anal fissures can cause bright red blood, while darker blood could indicate more serious conditions like peptic ulcers or colorectal cancer. Changes in diameter. Notice a change in the diameter of your stool. Narrow or pencil-thin stools can be a sign of a blockage in the colon, possibly due to polyps or colorectal cancer. If you notice this change, it's essential to get it checked out by a healthcare professional. Greasy or oily stools. Greasy or oily stools that are hard to flush might indicate that your body is not absorbing fat properly. This can be due to conditions like chronic pancreatitis, celiac disease, or cystic fibrosis. These stools often float and have a particularly foul odor. Undigested food. Seeing undigested food in your stool occasionally is normal, especially if you've eaten high-fiber foods. However, if it's a regular occurrence, it could indicate a problem with your digestive system, such as irritable bowel syndrome, IBS, or a condition affecting your stomach or small intestine. Pain during bowel movements. Experiencing pain during bowel movements. This could be a sign of hemorrhoids, anal fissures, or other issues. Chronic pain should not be ignored, as it can indicate more severe conditions like inflammatory bowel disease, IBD, or even colorectal cancer. And there you have it: 11 alarming things your stool says about your health. Remember, your body sends you signals in various ways, and your stool is one of them. If you notice any of these warning signs, it's essential to consult with a healthcare professional. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe to Bod Spa. Hit the bell icon for more health tips and wellness insights. Stay healthy, and we'll see you next time.